Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Esophageal Doppler monitoring. First, goal-directed therapy. In goal-directed therapy, we have to see for three different issues. First, you will have to check for hypovolemia. For checking hypovolemia, you can do esophageal Doppler monitoring. And by doing esophageal Doppler monitoring, you can find out the corrected flow time across the descending aorta. If the collected flow time across the descending aorta is more than 400 milliseconds, then it is normal. If the corrected uh, flow time across the descending aorta is less than 350 milliseconds, then that means there is hypovolemia. Each 250 ml of fluid stroke volume should increase by 10%. Then stroke volume. Stroke volume indicates fluid responsiveness. Stroke volume variation. Stroke volume variation uh, can be done in stroke volume variation in inspiration and expiration can also be calculated by esophageal Doppler monitoring. So with esophageal Doppler monitoring, we can calculate three parameters. One, flow time across the descending aorta. Second, stroke volume or fluid responsiveness. Third, stroke volume variation in inspiration and expiration. Then pulmonary artery catheterization. In pulmonary artery catheterization, pulmonary artery occlusion pressure can be calculated. That is, pulmonary capillary wedge pressure can be calculated. And cardiac output can also be calculated by pulmonary artery catheterization. Thus, pulmonary artery catheterization will help us to calculate pulmonary artery occlusion pressure and cardiac output. Then third parameter is arterial cannulation. With the help of arterial cannulation, we can calculate stroke volume variation, pulse pressure variation and systolic pressure variation. So with arterial cannulation, if stroke volume variation and pulse volume variation is found to be more than 15%, then it is hypovolemia. If the systolic pressure variation is found to be more than 10%, it is hypovolemia. So among all these, the best parameter for assessing the fluid responsiveness or to detect hypovolemia is corrected flow time across the descending aorta and stroke volume. So these two are the best parameters. So flow time across the descending aorta and stroke volume variation are best to assess the hypovolemia and fluid responsiveness. And among these two, if you have to select one, it is flow time across the descending aorta. Replace goal directed therapy. In goal directed therapy, first we will have to see the hypovolemia. We should assess two things. One, we should assess the hypovolemia should be assessed, which is important. So hypovolemia is assessed by three things. One, esophageal Doppler monitor. Second, pulmonary artery catheterization. And third, arterial cannulation. So first, esophageal Doppler monitor. In esophageal Doppler monitor, we see three parameters. One, corrected flow time across the descending aorta, stroke volume and stroke volume variation. Corrected flow time across the descending aorta. Normal corrected flow time across the descending aorta is 400 milliseconds, whereas if it is less than 350 milliseconds, then it suggests that there is hypovolemia. Stroke volume is better for fluid responsiveness, and stroke volume variation is also calculated. The variation of stroke volume in inspiration and expiration is calculated in stroke volume variation. Then pulmonary artery catheterization. In pulmonary artery catheterization, we will find out the pulmonary artery occlusion pressure and cardiac output. With the help of pulmonary artery occlusion pressure, pulmonary capillary wedge pressure can also be calculated. Then arterial cannulation. In the arterial cannulation, we have three parameters which we calculate. We calculate stroke volume variation, pulse pressure variation, and systolic pressure variation. Stroke volume variation and pulse pressure variation, if they are more than 15%, then it is hypovolemia. If systolic pressure variation is found to be more than 10%, then it is hypovolemia. Now, the best parameter among all these is one thing, which is flow time across the descending aorta is the best variation, best parameter. The second best is stroke volume.
Thank you and thank you for watching.